Rikki. So today we're going to be doing some talks on Andrea. She is one of my beautiful patients. She's a regular, so we're going to just kind of touch up her wrinkles and make sure she's nice and smooth.
Baby, you poppin', you got me Gucci. You got them boys on the pressure, you like a movie. I'm down to love you forever, ain't gonna lose
Before
it.
any kind of procedure, we always want to make sure we take pre-pictures. So we want to see what her movement looks like before. So go ahead, Andrea, bring your eyebrows up, raising your brows. Good. And then frown. And scrunch up your nose. We're looking for the bunnies there and the eyes. And then go ahead and smile nice and big. Perfect. Okay, that's it. So then we'll be able to revisit these photos after her treatment has taken place so we can see the difference and we can always have a clear picture that we're seeing the same thing from before. Here at Golden Aesthetic, we want to make sure that your experiences are as comfortable as possible and make sure that they're tailored to you. So when some people have a little anxiety or they might feel a little bit of pain when they have this procedure, I always offer them if they'd like numbing cream for before their treatment, and I always use ice because that's going to help squeeze down the blood vessels and make a bruise less likely to happen. It never takes away the risk, but it actually reduces it. So Andrea did decide to get some numbing cream. So we have the container right here, and I'm just going to gently place that onto her skin. Let it absorb. This is a lidocaine mix, so it actually goes into the skin and is going to make everything feel super comfortable. All right, so Andrea already received her digital copies of her intake form, but I want to make sure that she has a signed consent for her treatment, which we're going to complete right now because we already did your information, but we want to make sure that every treatment has consented for also the procedure. So you can go ahead and click there, read over any information you'd like to. And now we're actually set for treatment. We already took our pictures, our consent is done, and now we'll just go over her areas of concern. All right, so now we're going to go ahead and talk about your areas of concern. So what areas do you want to treat today?
Forehead,
Okay.
crow's feet, glabella.
Oh, Mentellus a little bit?
What do I think about the...
I think a little touch in here would be good to keep you get from getting some orange peel chin or some of that
kind of like
cobblestone thing.
bumpy
Very,
there.
very light, very light.
Definitely my masters.
Okay.
And what else do I get
Do you do
done?
bunnies usually? Go and scrunch up? I think that would be good for you,
bunnies.
just overall. Clench your teeth. Really tight. You don't have any platysmal bands, which is fantastic. Good for you.
Where else do I need some talk?
Blow kiss. Have you ever done like lip flip or anything like that? No. So if you start to see any lines appearing here, that's the time to start thinking about it.
I have done a lip flip once.
Okay. It's not necessary every time, but definitely if you start to see something etched there or the makeup starts to kind of settle in that area, I would suggest that's a kind of time to just periodically treat it.
Okay.
But I agree. Yeah, let's do some Mentellus. We'll do bunnies, crows, Mentellus, and glabella, and give you an overall. Oh, and then not to forget the masseters for your TMJ. Grinding, yes. Okay, cool. Okay, so today we're going to be using Jeuveau, which is a neuromodulator. That means that it relaxes muscles, and we're aiming to treat the muscles that crease the skin, creating wrinkles. So today we're going to use Jeuveau, which is you know, a really great neuromodulator. I'm going to mix it with 2.5 cc's of bacteriostatic normal saline. So for her injections, I really like to use an insulin needle. So you can't use the insulin needle through this hub or else it'll make the needle very dull. And then that can cause more bruising and pain and discomfort to your patient. So I actually take this off, and Jeuveau has a really great tab that can be released because they know that injectors like to do this as well. This is my insulin needle. It's going to give me 30 units in this one, and a very, very tiny little fine needle, which is going to be very delicate on her skin. I'm not going to dunk the whole syringe in, but I'm just going to tip the needle into the solution and draw up my amount of tox. This is going to be what I will use for injection. And just do this over and over again. Alrighty, so we're getting ready to clean her skin, and we always want to make sure the patient's skin is clean, even if they come in fresh out of a shower. You just want to always make sure that we reduce any risk of infection as much as possible. Here we have some little stress balls. These are just little foam cushiony things to distract Andrea while we do her treatment. And I'm going to just come over here and clean. First I'm going to clean with alcohol, and then I will put some chlorhexidine, which is another kind of cleanser, just to make sure that we have a nice clean surface anywhere that I'm going to be treating. Oh yeah, see, okay, we got some stuff, some makeup, which is okay. That's the whole reason we do this. Also, if you're using alcohol, you want to make sure that the patient closes their eyes or you fan them, because it can have a bit of a burning sensation to the eyes. You doing okay? Okay, good. Okay, so as we go through the treatment, I'm going to ask her to animate so I can really see where the muscles have the most strength. So go ahead and smile for me, nice and big, so I can see that they pinch in here, and then this is where the creases will come into play. So I'm going to go ahead and ice that area. And smile big and relax. And I'm going to have a little bevel here. It looks like a big ball, but it's really just the carrier fluid, and then the particles will set in, and those are going to treat the muscle. So it looks crazy now, but it won't later. These will go away in about 15 minutes. And deep breath. Good. And smile nice and big. Good. Sorry. And smile. This is a little piece of ice that I'm using to relax, or to actually make her feel a little bit better, less pain. Do you think the ice helps, Andrea?
No.
No?
I don't like the ice.
You don't like it? Okay. So that she doesn't like it, so we'll stop doing that and we'll use just the treatment. Okay. And deep breath. Does it hurt more? Or is it just distracting?
I don't know.
You just don't like it?
I don't think it hurts. Like, tox doesn't hurt that much to me. Like, I feel like the ice, like, just kind of like, I don't know, that cold feeling.
Okay.
It's not worth it.
It's not for you?
Yeah.
Okay.
For me personally.
Yeah, it's okay.
Personal.
It's totally a personal preference. I also feel like does that feel better too when I could make the skin tighter? No.
Nope.
You're not. Sorry.
That's fine.
Go and smile big. Good. Okay.
My face through a lot.
Oh yeah. And that's a sensitive area for a lot of people. Where do you think is the worst area for you?
For tox.
Like pain wise?
I couldn't even.
No?
Like, after it's done,
You can't even remember.
Like, sticks out in my mind as like as having hurt, because it's such a
Quick.
like a second. Yeah.
Okay, go and scrunch up your nose. Okay, and deep breath. Okay, this one is the nasalis muscle. It comes like a rubber band over the nose. And go and scrunch up your nose. You can see these little guys, they start to scrunch up when everything else is relaxed. So we want to give her a full global treatment. And so that's how we're doing the bunnies. And relax.
That didn't feel great.
Go and frown and relax. Deep breath. Good. When I do mine, I put like numbing cream on for like an hour before. Feels like nothing. But poking yourself is like also not great. Okay, go and frown. Good. And relax.
Oh wait, frown.
Uh-huh. So you can see her muscle right here, the corrugator pulls in. So this is where we're going to treat it. Right there.
How many units have you used?
Okay. So we have completed treatment around the orbicularis oculi, which creates the crow's feet, the nasalis, which creates the bunnies, the procerus, which pulls downwards like this, and the corrugators, which pull in. And we've used a total of 36 units so far. We're going to go ahead into the frontalis, which is actually the most complex muscle to treat. Everyone's forehead varies in size and strength. It also varies in how it moves, whether it moves just in the middle, mostly on the sides, or all throughout. So this is something that you really want to get to know your patient and see what they like and see how their muscles react to the dosage before you can get a really good treatment for them. So follow-ups are essential. Right now we're doing the frontalis muscle. So this muscle actually is divided into two sections. One part of it lifts the eyebrows up and one depresses the hairline down, and they meet together. So that's also another reason why it's so complex to treat this one. Raise your brows. Good. And relax. You also don't want to over treat this muscle because since it is required for lifting the brows, if you over treat it, it's going to give her a really heavy feeling. And that is no bueno. Nobody likes that. People actually will stop doing talks forever or maybe for a very long time if that happens to them because it's something they really don't like. And I always say we can add more treatment later if need be, but the only thing that's going to take away too much of a treatment is going to be time. So there's really no antidote to it except for just patience. Raise your brows. Good. And relax. And raise your brows. Good. And relax. All right. So now we're going to go to the masseters, which is these large muscles, the largest muscles in the face. Go ahead and clench your jaw. So I want to feel that strength of the muscles here. And you can't see it, but she's clenching her teeth.
What does this feel like? How does it feel enlarged to you?
Yeah, it bulks up. So I can feel when you're pressing
But
your
like
teeth.
mine in comparison to like other people, like how bad?
Okay. And relax. I would say that it's in comparison to other people, it's hard to do that because other people have such different bone structure than you, but your muscles are very small. Like you have very petite muscles in general. It's not like you have huge crow's feet and a huge strong frontalis. So in comparison, your masseters are very large compared to your other muscles.
Knew it.
I wouldn't say that they're like large in the big scheme of everyone, but in the spectrum of your own muscles, yes, they're very strong. Okay, clench. Does that make sense? Okay, deep breath. He's not available right now. And clench. And again. An important thing about the masseters is you want to know your anatomy. If you go too high, so there are 3 insertion sites for the masseter, like a triangle. If you go too high, you will hit the rosaris muscle, and that's going to cause a really funky looking smile later. So you want to just base in where the body of the muscle or the belly of the muscle is. I didn't mark it out here because I can definitely feel it, but 1, 2, 3 is where I treated this with about 12. How much do you usually treat with? Do you know? I have you're gonna end up with some extra, so we're gonna save it for a touch up.
Okay. I've gotten as much as 20 on each side.
Really? Huh.
But I've also gotten injected like further up at this like the TMD. Is that what it's called? TMJ. It's the what else is this? there a TM something else?
The TMJ is the
Like
temporomandibular joint. It's not the actual muscle that we're injecting. So at the junction, maybe?
like I've gotten injected for my clenching, but then for grinding, like further here and then like in this area.
Oh, the temples.
Not the temple. I don't know, like a couple points here.
Yes. So there's a temporalis muscle that also can start to compensate against this. So this is starting to get big. So then this guy kind of gets big in like conjunction, like biceps and the triceps, like they should go together.
Do you ever inject this?
If you have clench, oh yeah, you do have. Interesting. Again, yeah, we'll put a couple sprinkles in there. Okay.
Clench. It's like I could feel it at night, like all this like tension.
Again, clench. Good. And relax. And clench. I can see it. Okay. Deep breath. Good. And again, clench. And deep breath. So this muscle is deep as well.
Oh, yeah, I felt that one.
Okay. And clench. Yeah, I don't feel anything right here. And then relax and clench. Okay. Deep breath. Okay, good. And I'm going to go a little bit higher on this side too, because I did mostly lower here. But you guys want to listen to your patient, and if their history reflects in your exam, then it's up to you to decide to go forward with treatment there. I know Andrea, I trust her, so I feel like she knows what she's talking about. Go ahead and clench. Good. And relax. Deep breath. Okay, good. Now we're going to finish up with the mentalis, which is the chin muscle.
Oh,
so make a sad face. See these little dimplings right here? This muscle actually connects to the bone underneath, and then you can relax, Andrea, and actually attaches to the under surface of the skin. And so it pulls down like little tethers or like parachute strings, I like to say. And so it can start to actually indent the skin here, making it look cobblestoney or just kind of uneven. And that actually can't really be fixed with anything except for some really deep laser, some more toxin, and resurfacing, really. So prevention is key. Go ahead and sad face for me. Good, and relax. I'm going to actually zoom in on these areas that have the most pull. Again, and relax. And they're very superficial because I just want to relax the top of the muscle, because underneath the mentalis there are some pretty important structures that actually affect the smile. Sad face again. And relax. Okay, good. And that's all she'll need for now. And if we take a look back over here, you can see that that bubble is gone. It's been about 10 minutes. They're still a little inflamed, but they will resolve in shortly, maybe another 10, 20 minutes. So today we formulated about 100 units for Andrea's treatment. I didn't use everything, so we do have some left over that we can draw up later and revisit at her follow-up. She did purchase 100 units, so that's what we're going to use for her, and I know exactly how much we treated her with. I'll show you how we chart in just a little bit, and that way we can revisit what we did and look at her pictures, contrast those together, and make a perfect plan for her. Okay, so of course, last but not least, definitely not least, we want to chart exactly what happened in your patient's visit. This is going to be important because you're going to revisit this. If the patient says, oh, you know what, I don't feel like you treated my crow's feet, you can revisit and say, oh my gosh, you know what, we didn't. That's why they're moving. Or we did treat them, but maybe the treatment needs to be a little bit more powerful. So this is just a recording to make sure that we know exactly what we've done for the patient and we're all on the same page. I frequently review these charts with my patient together so we can see that it's exactly what I did and what I recorded, and I like to put the amount of units in each area that I did, and I'll show you how. Okay, last but not least, of course, is the charting. We want to have our chart note for every treatment. So here I have our SOAP note, subjective, routine, Jeuveau, which is what we did today. And I also want to include what I said, that she was clenching and grinding her teeth, and that's an important part of the master treatment we did. I also like to put this Fitzpatrick scale because it always reminds me which Fitzpatrick rating they are on, so then I can recommend certain skin cares, laser treatments, skin peels, any of those things that would be appropriately fitted to their certain Fitzpatrick scale. Objective, so she has movement all throughout the face, and for assessment and treatment, I want to say that I did Jeuveau to full face, and we can see the map here, so I don't have to write exactly what I did because it's already laid out here in a visual archive. Of course, we want to put our lot number and expiration date for our treatment and how many units I used. Our treatment plan is going to include 2 to 3 week follow-up, and then I can add or decide to reduce the treatment for next time. Like I said, you can't take it away, but you can always reduce the amount next time. Always include SPF and no exercise for 48 hours. Next thing is the thing we talked about today, which was off camera. We talked about filler to her hands for volume replacement, and then of course my signature at the end. If you got some value out of today's video, go ahead and subscribe for more videos like this. Let me know what you thought down in the comments, and I'll see you next time. Thanks for watching, and if you enjoy the aesthetic educational content, click here and subscribe for more.